My interview with the social worker consisted of 4 questions. Are the overdoses here in progress an isolated issue? How does the level of education work as a known trait of overdosing? Why would your employment have anything to do with overdosing? And what kind of impact does the opioid epidemic have on the healthcare system? City of Progress in relation to other cities in the United States and Canada. Progress's manufacturing plant has hazardous working conditions. Overdose drugs of choice are Oxycontin and heroin. Deaths are increasing due to overdoses, and the increase in overdose victims going to the emergency room are increasing. The total deaths of 2017 in the United States were 47,600. 4,173 of these were younger than 24, while 43,414 were between the ages of 25 and 55 plus years of age, while Progress had 22 deaths. What are the educational levels of those who overdose? Lower education levels. Lower education levels often experience limited job opportunities with poor economic prospects. Less educated people are more likely to be employed in jobs that have a higher risk of workplace injuries, being prescribed opioids, and an increasing chance of addiction. Higher educated people often start abusing opioids from prescription medications. Educational options are work with social workers, case managers, and local mental health to refer patients to behavioral counseling support groups, school programs on addiction and opioids, and educate families on addiction and opioid use. Employment of addicts. Are most of the people who overdose unemployed? Yes. In British Columbia, 26% of the people who died from 2011 to 2016 were employed for 5 years prior to fatally overdosing. Prior to overdosing, the drug addict earned an average of $28,437 a year, while an average worker earned $42,000 a year. A total difference of $13,563 a year less for opioid users. The City of Progress manufacturing plant has rumors of closing down. Most small commercial businesses that grew up around the plant stand a chance of going under as well. Some employment options are affordable insurance based on income while employed, companies offering options like physical and occupational therapy, and utilizing unemployment agencies to help find different work. The impact of overdosing for the healthcare system. It has been huge impact on the medical community around the world. It drains emergency medical system resources such as nurses, supplies, and time, as well as further reduces the emergency room and hospital ability to treat other patients. Options for healthcare include implement of in-house treatment programs via video conference, FaceTime, conference calls, or established medical website allowing for this. Increasing the availability of opioid dependency treatment, as well as to have the largest effect on the opioid crisis. These resources need to be funneled down to the governments with the greatest unmet need.
I utilized the scanning portion of the CRIM method to analyze the problem being seen in progress, including the areas of NIMS, Lakeside, and Bluffton. I looked at the statistics provided by Hackley Hospital, the medical examiner's office, and the police department and noticed a troubling trend. I noted the amount of overdose fatalities has been steadily increasing between the years of 2015 and 2018. I also noted a worry in that the traditionally lower crime areas of Lakeside and Bluffton have had a significant spike in overdose-related fatalities, and NIMS has been more steady. I asked why that was and noted 2 issues. The first is it seems to be an influx of people who have gotten addicted to opiate painkillers, including oxycodone and Vicodin. These individuals are now turning to heroin as they can no longer afford the prescription drugs, either because their doctors won't prescribe it, their insurance won't cover it, or they simply can't afford, and they turn to heroin as a cheaper alternative. The other issue I see is the zero-tolerance policing that has been implemented by the Progress Police Department, and I will talk about that more later on. I tried to determine who the stakeholders are, and I found that the local government, Hackley Hospital, the insurance agencies, the manufacturing facility, which makes up most of the employment in the town, the DEA, Drug Enforcement Administration, or the federal government, and the community members. Now, the community members are going to be the most important as they're the ones who actually influence the individuals who are dying because of the opiate epidemic. They're the brothers, sisters, cousins, friends, family, anyone who has direct contact with these individuals. To get a better idea of kind of what's going on in Progress, I conducted a detective interview of an individual from a neighboring police department in Muskegon County. The detective advised they are seeing an increase in heroin overdoses in Muskegon County, specifically the outer counter areas where he works. That includes the areas of Dalton Township and Eggleston Township. Now, like Progress, Muskegon has this high crime area, which is Muskegon Heights. Whereas Dalton and Eggleston Township are more lower crime areas, they're residential, they're where there's a bit more money, the manufacturing jobs or the people who work them live out that way. The detective advised they are also seeing an increase in the amount of burglaries and larcenies in these areas. I asked why that was. He advised it's because the people who are addicted to these illegal substances tend to need to steal to pay for them and to continue their habit. Lastly, and I said I'd get back to this zero tolerance policing, the detective advised they do still have a hometown securities task force assigned from the Michigan State Police to the Muskegon Heights. He advised this is a zero tolerance policing task force that goes in and just basically tries to weed out all the crime in the area. I see an issue with this. The first being it appears to be driving drug dealers and drug users out of Muskegon Heights as it is in NIMS and into the areas of Lakeside and Bluffton. The other issue I see with it is it tends to cause a very big issue between the police and the community, as the police aren't really looking to help the community, they're just looking to arrest people.
By using the crime triangle, I went step by step in identifying an offender, a victim, and a crime scene or location. The crime triangle suggests asking who, what, when, where, how, and why. The majority of my research was spent on the victim and suspect because research shows that a small number of victims account for a large number of crime incidents. Through my research, I also discovered specifically the percentage of those affected by the drug problem and discovered where it is taking place and why. So to start off with the victims, I identified the manufacturer workers as a part of this. They're being prescribed Oxycontin by the company doctors for any complaint of pain. The doctors have cut back on prescribing the drug due to complaints from the DEA. Therefore, the workers have begun buying heroin and other opioids off the street to feed their addiction. In 2017, 321 workers reported work-sustained injuries. 5 of them were hospitalized, and 234 were prescribed with opioid, Oxycontin, roxicodone, hydrocodone, and fentanyl. 85% of residents in NIMS were reported accidental overdoses from heroin, meth, and crack cocaine. The remaining 15% of overdose deaths were recorded in residential houses and other areas of Progress. So I associated that part with the dealers and the buyers. Moving on to suspects, I identified pharmaceutical and insurance companies. The insurance carrier discontinued hospital stays by offering pharmaceutical assistance for workers. Therefore, the pharmaceutical companies and insurance companies I felt like were suspects to the drug problem. Also, rival gangs are supplying to drug houses and NIMS and other blue-collar type of homes. And then I also identified police officers in the suspects. I would consider them, though, to be unintentional suspects of the problem because for medical reasons, they are carrying Narcan in case they have to come across someone who has overdosed. So could they technically be a part of the drug problem? Sure, but I wouldn't consider them the main reason. I also said that hospitals were suspects of the problem too. I would also consider them to be unintentional because in the article it states that it's not uncommon to give addicts Narcan for an overdose after they have been released. So kind of like the police officers, I wouldn't really consider them to be intentional. Could they be part of the problem? Sure, but I wouldn't consider them the major part of it. Moving on to managers, I identified the Progress Police Department. They are relying on zero tolerance policing and stop and frisk. With these efforts, they have noticed less street drug activity and the arrest of dealers and buyers has declined. For example, in 2015, there were 38 drug arrests in NIMS, and in 2018, there were 28 drug arrests, which is a significant decrease in crime. The location of the drug problem, it is in NIMS, Lakeside, and Bluffton. It's in all 3, but most of the problem is in NIMS. The manufacturing plant, I believe, plays a big role in the drug problem because its 3,000 workers makes up a fifth of the population in the city of Progress. And most of the employees are blue collar, and NIMS is a blue collar area. Therefore, most of the workers live in NIMS, which is why the drug problem is primarily in NIMS. In 2015, NIMS had 10 overdose deaths, whereas Lakeside and Bluffton only had 1. So that kind of backs up why NIMS is the major part of the drug problem.
We have identified a series of problems that are involved with this drug issue that we're seeing in our community. The first one that we have noticed are that company doctors are prescribing OxyContin to the workers that complain of pain. Most of this issue stems from the fact that insurance companies will cover the cost of the prescriptions, but not hospital stays. This leads to workers developing an addiction to OxyContin. The second issue that we're seeing is that hospitals are simply releasing overdose patients with only little self-help cards and Narcan in case they overdose again. And the final issue that we're seeing is that when the DEA did acknowledge this issue, the prescriptions became harder to get for those workers. Therefore, this caused the workers to turn to streets or street gangs to get OxyContin. And when these were not available or out of their price range, workers began the use of heroin in order to fill that high. To begin, we are going to decipher what parts of the crime triangle are involved in the first problem statement, which is company doctors are prescribing OxyContin to workers that complain of pain because of the prescription coverage. The suspects of this crime would be the company doctors, who are more than likely wishing to make a profit off of the large amounts of OxyContin being prescribed to the victims. The victims being the workers. The workers haven't been told or given anything else to attempt to stop the pain before they were given such a highly addictive pain medication. No warning was issued about the addictive side effects, and no counseling was suggested along with the prescription. We have decided that the best way to handle this problem is to mandate alternative ideas and/or policies within the company. While we ourselves cannot do that, we can appeal to the managers and HR department, as well as the company doctors, to figure out alternative ways that we can eliminate pain from workers' injuries without the immediate use of OxyContin. To do this, we would appeal by showing how the use of OxyContin affects work efficiency. This would help for the HR department as well as the managers to show that their employees cannot be under the influence of OxyContin because it would cause problems with work efficiency as well as health problems that the company could be liable for because of the company doctors being the ones prescribing these. We would show how more injuries to employees are being caused due to being under the influence, and then it would be a liability for the company to be prescribing it and allowing these people to come back to work in possible hazardous conditions. Then we would try to show them how the number of OxyContin prescriptions being prescribed is, in fact, increasing the amount of overdoses that we are seeing. Overdoses do include death as well as injuries. The company's employees are being hospitalized and dying, which is not good for any company, and I'm hoping that they will see this and put in alternative policies to eliminate the pain before immediately prescribing OxyContin. Next, to solve problem number 2 about how hospitals are releasing overdose patients with simple self-help cards and providing the addicts with Narcan to take home, we are going to decide that the suspects and the victims here include the hospital and their policies and the patients who are being released. The patients are being released with responsive medication and not preventative medication. The responsive medication being that they could simply just take the Narcan if they overdose again, and in the eyes of the patient, that would be fine. When Narcan is given to patients after they've already overdosed, whether it is a major or mild case, it can be life-saving, although hospitals aren't providing patients with ways to prevent the overdose by offering counseling or mild or drug substitutions. Instead, they are simply giving a drug the response to the aftermath of an overdose. In order to better solve this issue, a follow-up meeting with the social worker and policymakers at the hospital needs to be scheduled. Here, we will work alongside hospital policymakers and internal employees to come up with ideas on how we can take preventative steps to overcome this issue and reduce the number of overdoses and deaths that are coming into the hospital. Nurses, doctors, receptionists, and the social workers all come in direct contact with the patients. They would better know the traits and behaviors. Using the information gathered from the employees, we could look for ways to stop the behavior in itself to avoid addicts from coming back for more Narcan. Ideas could include mandatory psych evaluations before being allowed to leave, treatment and recovery plans with a specialist, follow-up appointments with doctors to check on the status of their health from the overdose and to follow up with alternative pain management options, and finally, to see if low-cost or even outpatient rehab programs could be started. The final issue that we're going to discuss is that when workers were unable to get their medications covered anymore, they turned to the streets to be able to buy. This is when the tides kind of turned and the victims became the suspects in this case. When the DEA accomplished this, they made pain medications harder for those that were already addicted. This led to victims becoming the suspects due to their newfound drug addiction. The workers began looking at the streets and the gangs in order to find OxyContin. Studies find that when it was harder to get, or due to the street prices being too high, workers then turned to the use of heroin or other drugs in order to maintain that sense of high or pain relief similar to what they felt when they were taking OxyContin. To combat this issue, a system needs to be put into place in order to help or prevent addicts from growing. While prescriptions are now more difficult to get, the addictions have already begun. Instead of saying no to prescription refills, doctors and pharmacies should discuss alternative pain relief options with their patients and be required to ask them a series of questions in order to determine if the addiction process has already begun. Again, preventative measures should be taken in order to minimize the amount of street drugs in our community. If addiction has already begun to take place, patients should be made aware of their options to combat it before it gets out of control. Counselors should be on hand to discuss these with the patients and search for possible rehab options, permanent counseling visit options, and other forms of treatment for the patients.
In order to assess if our responses have worked, it would be best to base it off the same data that we got our research points from. We would analyze if the number of deaths by overdose went down in each area of NIMS, Lakeside, and Bluffton. We would also analyze if the number of overdoses admitted to the hospital and number of arrests that were drug-related decreased. It would also be important to note which drugs increased or decreased. That's important because meth and cocaine have been decreasing over the years since 2015, but prescriptions, heroin, and synthetic opioids have increased since 2015. That means if those continue to increase or that cocaine and meth increase, then our responses are either combating the problem or creating new problems. If the numbers do not decrease in the way that we anticipate from implementing these ideas, then the best idea would be to go back to the beginning to see where we went wrong and come up with new ideas to combat the problem. Based on the ideas to reduce drug crimes and overdoses, some of these concepts could potentially be beneficial for some other crimes, but overall these concepts are based primarily on the problem at hand of the opioid epidemic. With the steps we've taken to solve the issues of drugs within our community, we hope to decrease not only the amount of overdoses occurring, but also the amount of drug-related crimes taking place within our community in which the police respond to. Overall, these solutions would require time to manifest within the community before we could assess if the responses are working. By our calculations, there should be a drastic decrease in the amount of overdoses and drug-related crimes occurring within our neighborhoods. We plan to reevaluate within the year to determine if these practices are in fact working and to see how we could better improve the steps already taken as well. If our responses are indeed working to decrease the overdose and crime issues that police are having to deal with, then we will continue to assess the results over the next 2 to 5 years to make sure that the responses are still appropriate for the problem and that it's not going to dissipate after the first year. While our zero tolerance policy was effective for a short period of time, it was difficult to enforce when it came to the use of legal and prescribed medications. We hope that our new preventative method will accomplish our goal and keep our citizens safe and healthy for the years to come.